my name is Donna. I am a 56-year-old native Atlantan. I am a mom of 3, a grandmother of 4. I am a patient advocate, a speaker, a volunteer, and I've been living with Crohn's disease now for 23 years. I honestly believe that I've been living with Crohn's disease for most of my life. However, I was diagnosed officially in 2003 after my colon ruptured. I was placed on prednisone initially back in 2019, and at the time I was in the hospital during a flare. I was told that it was the medication that was most effective in reducing inflammation in a timely manner. I was not privy to any of the side effects, not the weight gain. And so when it happened, I was in shock. I recall getting on the scale and having gone from 160 to about 205 in a couple of weeks really blew my mind. Prior to taking prednisone, I had never been overweight, so it really put me in a different position in life, and it was a bit much for me not having been there before. The weight gain had a huge impact on my self-esteem. I didn't see myself as I had previously. I was depressed. It was just a lot to take in from an emotional perspective. Physically, I had knee pain, chronic fatigue, abdominal pain. I was diagnosed with elevated blood pressure in addition to elevated cholesterol. The toll that it was taking on my body physically pushed me into some chronic diseases that were never on the radar for me, in addition to just not feeling good in my body. I stopped prednisone after about 3 months and the weight just stayed there. I can recall having conversations with my doctors where they didn't acknowledge my perspective. I mean, we could obviously see that I had gained weight, but they kept telling me that I would lose the weight over time or that it wasn't a big deal. And so I felt a bit dismissed. Eventually, we did get to a point where they allowed me to participate in my care, and we developed a plan to lose the weight. I think the most important thing for gastroenterologists to know when treating patients who are overweight or obese is that it's a sensitive topic. So please approach it with empathy and always have open and honest communication. I think it would have been a better experience for me had I seen it coming, and maybe we worked out a game plan initially. I did eventually get my weight under control. After several visits to my PCP, she recommended that I go to a health clinic, which they specialized in weight loss. It's still a work in progress, but I'm happy with my progress up to this point.